Thanks very much, Tyler. And folks, what you can't see from at home is that we are in an AHS warehouse that is 150,000 square feet, approximately. We have 9 warehouses, 2 of this size, filled with equipment. And we wanted to make this announcement here to demonstrate Alberta's readiness for this pandemic. I'll get to that in a moment, but let me begin by wishing everybody who is celebrating a blessed Easter, as well as friends in the Jewish community, a happy Passover. And on Monday, the Sikh community will begin to celebrate Vaisakhi, as well as also known as Khalsa Day. And I wanted to begin by noting that all of these and other faith traditions, the Islamic community that will soon begin commemorating Ramadan, each one of them had their own version of the golden rule, the idea of do unto others as you would have them do unto you. And at this holy time of year for many people, many Albertans, it is, I think, useful for us to stop and dwell for a moment on that common concept that runs through all of those different traditions. In Christianity, it's expressed as the idea of charity, of expressing God's love through love for our neighbors. In Judaism, it's expressed in the tradition of tikkun olam, or to repair the world, the notion of bearing responsibility for others. And in Sikhism, as we prepare for Vaisakhi on Monday, it's the notion of seva, the idea of doing work or service for others without any expectation of reward or compensation. And all of these concepts of the golden rule were beautifully summarized in a way that's relevant to the coronavirus pandemic for me by a recent statement by a Chabad rabbi, Barry Farkash. And let me just quote from this. He said that, quotes, "Exponential growth is not exclusive to viruses. We can also create exponential growth when we reach out to 2 to 3 people every day to say hello, check in, and share kindness. If every person who receives kindness passes it on to 2 or 3 more people, that will also create exponential growth. The math is exactly the same. So make a commitment to check in with 2 or 3 people every single day. Reach out to family, friends, neighbors, coworkers, former classmates. Even a short text message can make all the difference. And if we counter social distancing with exponential kindness, we may just bring the light someone needs during this difficult time," unquote. So thank you to Rabbi Farkash for that beautiful expression of how we can apply the golden rule even in these strange times. And I have another important public service announcement to make before today's announcement. Yesterday, I received an email at the Premier's inbox from Veronica McLaughlin, who identifies herself as an 8-year-old living in Calgary. And she said, "Dear Premier, I'm worried about Easter this year. Is the Easter Bunny going to be able to come and hide the eggs? My whole family was wondering and worrying about Easter, and we are wondering if you know if the Easter Bunny is going to come this year. Can you lift the travel ban for the Easter Bunny? Please respond soon. Yours sincerely, Veronica McLaughlin." So Veronica, if you or other kids are watching, I'm pleased to assure you that we have declared the Easter Bunny an essential service, and there is no travel ban. We ask the Easter Bunny, however, to observe the hygiene protocol and to wash his hands for at least 20 seconds under hot, soapy water frequently. And we know, Veronica, you're following the same advice. So before we get to the substance of today's announcement, I also have the latest update on figures from Alberta Health Services. The most recent data is that we have seen an addition of 69 confirmed cases of COVID infection over the past 24 hours, bringing us to 1,569 confirmed cases, and that is on nearly 73,000 completed tests. 47 Albertans are hospitalized due to the coronavirus. That's a reduction of 1 from yesterday. We continue to see 13 people in intensive care units as a result of COVID. And I'm sad to report 1 additional death as a result of COVID infection. And that individual passed away in Calgary. We express our condolences to the family of not just that person, but all 40 whose lives have been lost over the course of the past 3 weeks in Alberta from this pandemic. I can also report that we have seen 744 recovered cases, which is 48% of all known infections. We can also take confidence and encouragement from the relatively low number of hospitalizations. In fact, the number of individuals in ICU as a result of COVID-19 is down slightly this week, and hospitalizations have been quite stable this past week. Our numbers are far lower than the hardest hit areas of Europe, the United States, and significantly lower than we've seen in provinces like Quebec and Ontario. Earlier this week, we shared the models developed by Alberta Health to chart the possible future trajectory of the pandemic in our province. They suggested 3 scenarios, starting with the probable one, which would see a total of 800,000 infections during the primary wave of the pandemic ending in August, and a peak of 818 hospitalizations and 232 ICU patients in late May or early June. The second, or elevated scenario, would envision total infections of just over 1 million and a peak of roughly 1,600 hospitalizations and 400 ICU patients in early May. And as I explained before, they also prepared an extreme scenario which would only apply had we not taken rigorous measures to date. The Alberta Health modeling charted anticipated hospitalizations and ICU admissions against the planned expansion of hospital and ICU beds for COVID patients. So far, we are outperforming the probable scenario and doing much, much better than the elevated scenario. The probable scenario envisioned over 200 hospitalizations, including about 30 in ICU. But today we're far below that, as I've said, at 47 hospitalizations and 13 in ICU. So we are at about 1/4 of the modeled levels under our probable scenario for today, and that is very good news. It is not a reason to stop our collective efforts to stop the spread, but it is a reason on this weekend of hope for many people to take some hope in the progress that we're making. This adds to our growing confidence that under both the probable and elevated scenarios, we'll have a substantial excess capacity of beds and medical protective equipment beyond the expected need. Now, let me just say again that we have this excess capacity of equipment, both protective equipment and ventilators now and anticipated as we grow those supplies, in part because of the excellent pandemic planning that has been done for a long time. On the very first day when we, I think as Albertans, really started to focus on this about 3 weeks ago, following the World Health Organization's declaration of a global pandemic, and when we started to see cases manifesting in Alberta, on that very first day, I pointed out to Albertans that we were well prepared, that we have had a influenza pandemic plan in place since 2014, and that it was exercised in November. And part of that preparedness was the excellent work done by Alberta Health Services Procurement Division, led by Mr. Jitendra Prasad, who you'll hear from in a moment, who have really harnessed the enormous purchasing power of the one centralized administration of healthcare in Alberta. We are the largest single point of purchasing of healthcare equipment in Canada. And we rank on a global scale in terms of our purchasing power. Mr. Prasad and his team have used that to develop deep relationships with suppliers around the world. And when Mr. Prasad first heard intimations about a potential virus of this nature late last year, AHS surged orders for equipment to get ahead of the queue. And that is why we are now receiving enormous shipments of supplies, PPE, and we are on track, in fact, ahead of track. And let me just say that I actually, because of the success of AHS procurement, because of those privileged relationships we have with suppliers around the world, complemented as well by progress that we are making with domestic development and procurement of products here in Canada and in Alberta. Because of those things, I directed AHS procurement last week to go big, to effectively order as much supplies as they can, so that we could then in turn share excess supplies with fellow Canadians, as some other provincial governments were not as advanced as we were in stockpiling materials. Because we are so well equipped, I am pleased to announce that we are able to contribute 750,000 N95 masks, 4.5 million procedural masks, and 30 million protective gloves to provinces that are right now in need. Our stockpile also includes a large supply of ventilators, which are a last-ditch defense for severely ill patients in the ICUs. We are doubling our supply of ventilators to more than 760 by the end of April. That means we expect to have about 500 more ventilators than the 200 or 30 that we will require under the probable scenario, and well over 300 more than the approximately 400 we would need under the elevated scenario. For all of these reasons, Alberta finds itself in a position to help some of our fellow Canadians living in parts of the country who are facing much worse spread of the infection and are less well prepared than we are in terms of equipment. I am therefore very pleased that Alberta is in a position to share medical resources with other provinces facing urgent shortages of life-saving equipment, including ventilators. The current hospital need is particularly in Quebec and Ontario. Their rates of infection, hospitalization, ICU admissions, and death are much higher than ours. And some of their models indicate a high risk of shortages of personal protective equipment and patient treatment tools, including ventilators. We are therefore making the following equipment immediately available to Ontario, Quebec, and British Columbia. First to Ontario, which is currently reporting more than 6,200 infections, 673 hospitalizations, including 260 in ICU and 217 on ventilators. They've also sadly seen 222 deaths of date. To Ontarians, we are providing 250,000 N95 masks, 2.5 million procedural masks, 15 million gloves, 87,000 goggles, and 50 ventilators. Secondly, to Quebec, which is currently reporting nearly 12,000 infections, over 700 hospitalizations, including 186 in ICU, and approximately 250 deaths. To Quebec, we are sending immediately 250,000 N95 masks, 2 million procedural masks, 15 million gloves. And lastly, to British Columbia, which, like Alberta, has had great success so far in containing the outbreak, but has experienced a relatively high number of hospitalizations and is short on N95 masks. To British Columbia, we'll be sending 250,000 N95 masks.